Milk fever, also known as parturient paresis or hypocalcemia, is a metabolic disorder that commonly affects dairy cows, especially those of high-producing breeds, around the time of calving. This condition arises due to a sudden drop in blood calcium levels, which can have serious consequences for both the cow's health and the productivity of the dairy operation. Understanding milk fever, its causes, symptoms, prevention, and treatment is crucial for farmers, veterinarians, and anyone involved in animal husbandry. Milk fever typically occurs within the first 72 hours after calving. During this period, the cow's body is under tremendous physiological stress as it begins to produce large quantities of milk, which is rich in calcium. The sudden demand for calcium to support milk production often exceeds the cow's ability to mobilize or absorb enough calcium from her bones and diet. As a result, blood calcium levels can plummet, leading to the onset of milk fever. The name milk fever is somewhat misleading, as fever is not a characteristic symptom of the disease. Instead, the term comes from the association with lactation, or milk production, and the early medical misunderstanding of the disease. Milk fever is most commonly seen in older, high-yielding dairy cows, particularly those in their third or subsequent lactations. These cows tend to have higher milk output and, over time, their ability to draw calcium from their bones can be reduced. Jerseys and other high-producing breeds are especially susceptible, but any cow can be affected. The disease can be broken down into 3 stages, each with distinct clinical signs. In the first stage, symptoms can be subtle and easily missed. The cow may appear restless, walk with an unsteady gait, or tremble. She may shift her weight from leg to leg, and her appetite may decrease. This stage is brief and can quickly progress if not recognized. Stage 2 is more severe. The cow will often be found lying down and unable to stand. Her body temperature may drop, and her extremities, such as ears and limbs, will feel cold to the touch. The cow's muscles become weak, and her digestive system slows down, leading to constipation and reduced rumen activity. The heart rate increases, and the pulse becomes weak. If untreated, the cow's condition deteriorates rapidly. Stage 3 is critical. The cow becomes completely recumbent, lying flat on her side, often with her head turned back towards her flank. She may lose consciousness, and her body becomes very cold. Death can occur within hours if urgent intervention is not provided. The underlying cause of milk fever is hypocalcemia, or low blood calcium. Calcium is essential for muscle contraction, nerve function, and various metabolic processes. When blood calcium drops, the cow's muscles, including those needed for standing, swallowing, and the heart, cannot function properly. This is why affected cows collapse and may eventually die without prompt treatment. Several factors contribute to the development of milk fever. Diet plays a significant role. Cows that consume high-calcium diets during the dry period, the weeks leading up to calving, can have suppressed mechanisms for mobilizing calcium from bone stores. When the demand for calcium suddenly increases at calving, their bodies are slow to respond. Similarly, certain mineral imbalances, such as high levels of potassium or magnesium in the diet, can interfere with calcium absorption and mobilization. Genetics also play a role, as some cows are more prone to milk fever than others. High-producing cows, older cows, and those with a history of milk fever are at greater risk. Environmental stresses, such as cold weather or sudden changes in feed, can further increase susceptibility. Prevention is always preferable to treatment. Managing the diet of dry cows is a critical strategy in reducing the incidence of milk fever. One widely used approach is to feed a diet low in calcium during the dry period. This stimulates the cow's natural mechanisms for mobilizing calcium from her bones and absorbing it from her intestines. When calving occurs and calcium demand increases, her body is primed to meet that need. Another preventive strategy involves the use of dietary cation-anion difference, or DCAD. By manipulating the balance of certain minerals in the diet, specifically by increasing the anion content relative to cations, farmers can acidify the blood slightly. This metabolic change enhances the cow's ability to mobilize calcium at calving. Specially formulated mineral supplements are available for this purpose and should be used under veterinary guidance. In addition to dietary management, some farms administer oral calcium supplements at calving to at-risk cows. These come in the form of gels, drenches, or boluses. While helpful, these supplements should not replace proper nutritional management during the dry period. Despite best efforts, cases of milk fever can still occur. Prompt recognition and treatment are vital. The primary treatment is the administration of calcium, usually in the form of calcium pergluconate, given intravenously by a veterinarian. This rapidly restores blood calcium levels and can result in dramatic improvement, sometimes within minutes. In less severe cases, or as a follow-up, calcium can be given subcutaneously or orally. After treatment, cows should be monitored closely. They may require additional calcium supplementation and should be supported with good nursing care, such as providing soft bedding and assistance in standing. Preventing relapse is important, as cows that have had milk fever are at increased risk of subsequent episodes, as well as other complications like retained placenta, mastitis, or uterine infections. The economic impact of milk fever on dairy operations can be significant. Aside from the immediate risk to the cow's life, affected animals often have decreased milk production, delayed return to estrus, and increased susceptibility to other diseases. Veterinary costs and time spent on care can add up, making prevention and early intervention all the more important. In summary, milk fever is a serious and potentially life-threatening condition that can strike dairy cows around calving. By understanding the causes, recognizing the signs, and implementing effective prevention and treatment strategies, farmers can safeguard the health of their cows and the productivity of their herds. Knowledge, vigilance, and a proactive approach are the most powerful tools in the ongoing effort to control milk fever and ensure the well-being of dairy cattle.